Okay, hello everyone. My name is Emily Silvius. I am a third-year student in the Doctorate of Occupational Therapy program at the University of Toledo. I am pleased to join you guys in giving an explanation of what occupational therapy is, what some highlights of our program are, and hopefully answer some questions that you have when you look at the word occupational therapy and think, what in the world does that even mean? So we'll start with that exact question. What is occupational therapy? Just to kind of give a broad overview of the definition, OT is a healthcare profession that provides services to people whose ability to function in daily life has been disrupted by any of the following means of disruption, which include just the process of aging in general. Our patients might have some developmental problems, mental or emotional illness, physical illness or injury, and or all of the above. We work with a wide array of patients and can work in many different settings. When you hear the word occupation or occupational, a lot of people jump to the thought that occupation means job or career. And although that is not false, but when we use it in the terms of occupational therapy, we kind of broaden the definition of the word occupation into the meaning that we use it as is occupation is everything that a person does on a daily basis that has meaning and purpose. So not just your job, not just your career, that is included in occupation, but an occupation or an activity of daily living can examples of this can be tying your shoes, writing a paper, driving a car, in engaging in the community in any way, like going to the grocery store, or as I said earlier, performing tasks at a wage earning job. So any and all of the above are occupations or tasks that are addressed by occupational therapists, and we help our patients develop and maintain the skills necessary in order to function in their daily life to independently perform their everyday occupations. So when you think of what an occupation is, I encourage you to think not on the note of it just being a job, but anything that you need to do throughout your daily life to function, or anything that you want to do to function, anything that has meaning and purpose to you. So, my current occupation right now is sitting at my laptop recording this lecture capture for you. That is my current occupation. And your current occupation is sitting at your laptop or at your computer receiving um, my lecture capture. So your current occupation is sitting and engaging in this lecture capture. So that's just kind of a good example to orient yourself. Um, some Some different settings that we can work in include what is listed on the slide here, and I'll touch upon them each a little bit individually. But first, we can practice at private rehabilitation facilities, home health agencies, pediatric settings like hospitals and schools, mental health facilities, hospital settings like inpatient, outpatient, or acute care, any community-based setting, or retirement and daycare centers as well. So an example in the local community of a private rehabilitation facility might be, if you ever been to Health Science Campus, the uh, RHNL Rehab Hospital of Northwest Ohio is a rehabilitation hospital for people who have experienced an injury, like a spinal cord injury, traumatic brain injury, or any kind of orthopedic issues. Some home health care agencies in the area. Great Lakes Caring is the first one that comes to my mind. And in home health care, after a patient has been released from one of these rehabilitation facilities or been released from a hospital setting, they they are returned to home, but they might need a little help reorienting with their new functional status to their home. So they can receive occupational therapy services at home, and where the therapist just comes straight to their house. Some pediatric settings, including hospitals and schools. So occupational therapists can work in a school specifically with students in the classroom or in a separate therapy area of the school. There are pediatric rehabilitation outpatient facilities such as Rehab Dynamics in Ohio or in Northwest Ohio. Um, Mental health facilities. So mental health is actually where occupational therapy was born. Um, it's the idea of OT was originated in the field of mental health. So a mental health facility can be either outpatient or an example of a local Toledo mental health facility might be Flower Inpatient Psychiatric Unit. An occupational therapist might run groups to help patients work on coping skills and improving aspects of their daily living in regard to their mental health issues. Hospital settings like inpatient, outpatient, and acute care. Acute care is when a patient becomes immediately ill, and acute care is the first place they go. Someone has a heart attack or falls and breaks their hip. The first place that they're going to go is the emergency room, and they're going to be admitted to the hospital. That's what acute care is. And in that setting, an occupational therapist's role is to help streamline the process of rehabilitating the individual back to their daily life, considering their new injury or considering their new health condition, and helping them throughout the process and just kind of starting that process and um, helping the healthcare team decide what the next step for the patient, what the best next step for the patient is. So after they are medically stable in acute care, they will be either released to a skilled nursing facility or another step down hospital for rehabilitation of some sort, or they can go home. And the OT plays a big role in helping the team decide what that best next step is based on the current function of the patient. Community settings, I kind of mentioned earlier that mental health facilities can be community-based. So community settings such as the Thomas Wernert Center downtown Toledo is somewhere that we have had fieldwork experiences and have run groups for mental health. And the population there are patients, I guess, but we don't even call them patients. They are just members of the community, and we are providing services to the community as a whole through these community-based settings. So we might not be working with a patient individually one-on-one, like the image shown on the slide, but running groups and just helping patients or helping individuals advocate for their mental health on a community spectrum. Retirement and daycare centers, that's kind of self-explanatory. Any assisted living facility might have an occupational therapist on board to help make sure that residents are receiving what they need to best function within their home as independently as possible. This slide kind of looks a little bit more clearly at some examples of clients whom OTs work with. I kind of mentioned them a little bit earlier, but let's just be more clear about them here. So some clients that we work with can be individuals of any age, from birth up until older adult, who have physical, emotional, or developmental problems. Some examples of some physical problems or conditions that we might encounter on our day-to-day workload. We see patients with arthritis, hand and shoulder injuries, amputations, heart conditions, stroke, spinal cord injuries, just to name a few. Some emotional disorders might include depression, psychiatric behavioral disorders, or substance abuse disorders. So it's kind of interesting, but occupational therapy can play a role in almost any setting and with a wide variety of experience with different patients. So all the way from arthritis to substance abuse. That just kind of shows you how broad of a spectrum that we get to work with clients is. Some developmental disabilities or issues can include intellectual disabilities, autism, and learning disabilities. And again, we see patients with those types of diagnoses all the way through the entire spectrum of age. Although, so occupational therapists can work with babies in the NICU who are premature, and they might be recently diagnosed with cerebral palsy, or we can have someone with cerebral palsy who is in a skilled nursing facility and are already of older age. So with each of those types of diagnoses or types of clients, types of patients, we can provide a variety of different services, and those include just very general broad statements here on the slide. We can help individuals learn to care for their personal needs, such as bathing and dressing. So if you think of how you got ready this morning, whatever your morning routine was, some things that you did to get ready probably included brushing your teeth, washing your face, taking a shower, using the toilet, getting dressed, or any of the above, making your breakfast, driving to class, or well, you're probably at home. So any of the above that fall into your morning routine, that is the modality that occupational therapists use to get you back to your daily function. So someone who has recently had an injury might not be able to complete their day-to-day morning routine as they used to. So an occupational therapist's role is to help them learn to care for their personal needs in that manner. OTs help individuals learn new ways to perform household occupations such as meal prepping, shopping, and managing finances. Those higher level functional day-to-day activities are included as well. OTs develop or improve skills necessary to participate in even higher level occupations, such as going to school and completing your schoolwork, being attentive in a class, going to work, and completing your leisure occupations. Here are some more examples. OTs help individuals return to work and resume community occupations. They help individuals to develop the coping skills they need to maintain a healthy lifestyle. That goes back to our idea of mental health. OTs enable individuals to regain the use of an injured arm or poorly functioning hand. Say after a broken wrist or something similar, an OT can specialize in hand therapy and help a patient work through the healing process of a broken wrist. And after the fracture is healed completely, they might take patients through a process of regaining their range of motion, regaining the strength that they lost, and also just helping our individuals deal with the losses associated with aging and injury. So something that's nice about OT is, say if we're working with a patient's arm or hand, and that is the injury that they are referred to us from their physician for. We don't just look at the patient's arm or hand and treat just the arm or hand, but we look at the whole person from a holistic manner and make sure that we are treating not just that injured hand, but also looking at the whole person, because the whole person matters very strongly to us. So here are some advantages of occupational therapy as a healthcare profession. To this point, if after hearing me talk about the wide variety of patients that occupational therapists work with, that is one of our strengths. We are very flexible in the type of setting that we can work in. We are not just bound to working in a rehabilitation facility. We can work out in the community. We can help community-based programs develop programming to best serve individuals on a larger scale basis. So not just having our population be a one-on-one patient situation, but our population can be full community settings. There's a point here that talks about the holistic approach that I mentioned about looking at the entire person, not just addressing the injury or the condition that they are referred to us for. There's room to be creative. We're not just bound to completing a treatment session based on what the injury or what the protocol is from the physician. We get to be creative and use our occupational therapist brain to best treat the whole person holistically. And the last bullet point kind of goes along with flexibility. There is a very wide variety in the types of job settings that we have. So those are just some advantages there. So a lot of times at this point in the presentation, students might ask, all right, so that's kind of what OT is. That sounds really similar to PT. So what's the difference between an OT and a PT? So I'll try to explain that here. As I have been getting to, occupational therapy focuses on increasing the patient's functional independence for increased performance in occupations. So helping them regain the skills to make a meal for themselves, brush their teeth, get themselves ready in the morning, or care for a child, care for a loved one, and function in the community, function at work, function as a student, whereas a physical therapist is going to focus on functional independence for increased performance in mobility. So those are the two words that I'll have you just kind of reflect upon. So mobility, how well is the patient moving? How well can they walk or transfer themselves from one surface to another? What's their endurance look like? So an OT and a PT might work side by side with the patient at the same time, but the difference is a physical therapist, their goal is to help the patient regain aspects of functional mobility, where an OT has the goal for the patient to increase their functional independence related to their self-care, their ability to make a meal for themselves or something of that nature. So if you picture the situation of two therapists, one PT, one OT, working with the patient is standing at the sink working on dishes. The PT is making sure that the patient is gaining endurance, that they're standing with good posture, not having, well, they're working on endurance and being able to get to the sink, whereas the OT is kind of looking at what the upper body is doing, completing the dishes and going through some cognitive aspects of the complications of doing the dishes. Does the person know to rinse off the solid food before washing with a washcloth or with a sponge or something? So that's how you can kind of picture what the difference is. One way I like to put it is a physical therapist helps the patient get from point A to point B. So that's their mobility aspect. An occupational therapist works with the patient once they get to point B. Once they're in the kitchen, they'll work on functional occupations like feeding themselves or creating a meal, stuff like that. Whereas the PT's role was to help the patient become mobile enough to get to that point. So I hope that answers the question and kind of clears things up. So if you are on track to become an occupational therapist, there are multiple points of entry into the field. You can receive an entry-level doctoral degree from an accredited OT program like UT. But other programs offer master's degrees, and we'll kind of talk about the difference between a master's and a doctorate a little bit later. So that within the program of education to become either a doctorate of OT or a master's of OT, you will complete a period of supervised clinical experience. So you are right with the patients, right with other OTs, and gain experience before you are actually thrown into a job. And you must pass a national certification exam after you have completed an accredited OT program and completed your period of supervised clinical experience. This slide delineates some requirements to be admitted into the OT program at the University of Toledo specifically. I'll touch on them just briefly here. To get into the program, you need to have obtained a bachelor's degree with a minimum of 3.0 GPA. All applicants are required to submit a score from the GRE. There are prerequisites listed on our program's website, and I'll show you how to get to those prerequisites in a minute. You must submit a writing sample. There's a prompt that the application process asks you to complete a narrative on. The portal to apply for any occupational therapy program is through OTCAS, Occupational Therapy Center. I'm not sure what it stands for, but there's an application process specific to anything national for application to get into any OT program, and that link is here. And the University of Toledo also asks that the students submit an application just directly to the program as well. So not just going through the OTCAS portal, but also directly to the program. And the last link at the bottom shows some fast facts that better explain the application process and the prerequisites that I mentioned earlier, and some general questions that a lot of people have about the program. And so that's a really good resource if you are interested. Why study OT in the first place? So the field of occupational therapy, going along what I said a couple slides ago, is the field is very flexible. There are lots of job opportunities. There is always going to be a need for therapeutic services. There are always going to be adults who are reaching older age. There are always going to be children requiring therapy services. There are always going to be people experiencing injuries. There's always going to be a need for rehabilitation. So job security is one of the benefits of becoming an occupational therapist. This slide specifically looks at why you should study OT right here at the University of Toledo. First of all, we have an outstanding array of faculty with national reputations in the field of OT. There's more information on the occupational therapy at U Toledo page that I will refer to you in a web link. The majority of classes, just to kind of give you a snapshot into our program, majority of classes are held on Tuesday and Thursday all day, and then Wednesday afternoons. So this actually kind of looks like, oh, that's not a lot of demand on work. Well, the reason that they do that is because on Mondays and Fridays, that's when that's time that students are given to schedule meetings with faculty, complete research, and complete their fieldwork experiences. So there's a nice balance of fieldwork versus didactic in-class time. And that's unique to our program. And we also have a unique approach to the idea of therapeutic occupation and the idea of graduateness and graduate learning. We try our best to foster an environment of learning that is most beneficial for students to become the best occupational therapists that they can have the potential for. Here is a little bit more of a snapshot of what the program looks like. 3 years, 8 semesters spread out over 3 years. Programs start in the fall. So you have class through fall, spring, and then summer, and then fall again, spring again, and then the last 3 semesters are all fieldwork based and self-guided research and scholarly project based. The scholarly project that I was referring to is this capstone, which is our big end of semester project. I am in my capstone semester right now, and my goal this semester is to create a course development, whereas my other classmates are on these other tracks such as research or completing an advocacy project and creating a program for different clinics. So we are each on a different track to kind of enhance our learning in a self-guided manner, and we are individualized based on the project that we get to choose ourselves. So that's really nice that we get to choose our own project. It's not assigned to us. So I have a passion and a heart for teaching and learning and helping foster students in their clinical reasoning skills for becoming an occupational therapist. So that's the reason that I took this track to develop my skills in teaching. And this self-guided learning process, known as the capstone experience, the capstone semester, is the end product of how we demonstrate that we have, by the end of the program, increased our practice skills. So patient interaction, along with our autonomous decision making, which is the ability to kind of self-guide the process of professionalism. Supervisory skills, we get to experience interactions with other healthcare professionals that might be that we might have a supervisory relationship with. And just in general, the wave of the future in rehabilitation and community-based practice is moving from a medical model to a more community-based model. And occupational therapy is a good factor in that we have both the knowledge of practicing in a medical model as well as a community-based model. So there's going to be a higher demand in the near and far future for occupational therapists to help be that bridge. Here are some little tidbits or bonuses related to the University of Toledo's occupational therapy program. Some pluses include our lower cost tuition in comparison to nearby institutions. There's only 20 students in a class, so having that small class size results in closer relationships with our faculty and with each other as students. So that helps us learn and teach each other and grow and develop ourselves through the development of everyone else around us. That also contributes to the benefit of hands-on learning in our program. And just a little props to us. We are ranked by the U.S. News and World Report as a very highly established program. If you want more information on what I have discussed, you can go to the American Occupational Therapy Association's website, which is our national informative body, aota.org, or the equivalent of that specific to Ohio is the Ohio Occupational Therapy Association, oota.org. The website that I mentioned earlier, so our UT Occupational Therapy Programs website, that link is right here, and that gives more information specifically on admissions into the program. Well, it shows you what the students are doing currently, introduces you to the faculty, kind of gives you a snapshot into the research that we are completing. Or you could email the UT Occupational Therapy Program Director at octherapydoctorate@utoledo.edu. So that is all I have for you today. At this point in the presentation, I would open the floor to students to ask questions, but with this being a pre-recorded lecture capture, I'm just going to point students to my email and let you know that if you have any questions for me, you can email. I am usually pretty quick to respond, and I would love to have a conversation with you if you are interested in the program or just interested in occupational therapy in general. Thank you for listening.